Every year, millions of people experience a stroke. But here's what almost nobody tells you: in a large number of cases, the body was trying to warn them days, sometimes even a full week, before it happened. Not with a dramatic collapse. Not with an obvious emergency. With small, easy-to-dismiss signals: a strange headache, a moment of clumsiness, a word that wouldn't come out right. Most people miss these signs completely because they don't look like what we've been taught a stroke looks like. We've all seen the movies: someone suddenly collapses, one side of their face goes slack, and it's immediately obvious something catastrophic is happening. But the truth is, the body often gives quieter, earlier warnings that come and go, sometimes lasting only a few minutes, before the real event occurs. In this video, I'm going to walk you through 9 of these warning signs, explain exactly what's happening inside your brain and blood vessels when each one occurs, and tell you what you need to do the moment you notice them. Because with stroke, more than almost any other medical event, time is everything. The faster you act, the more of your brain, and your life, you protect. Stick with me until the end, because sign number 7 is the one doctors say is misdiagnosed more than any other, and sign number 9 is something most people have felt at some point and completely brushed off. Before we get into it, if you're new here, welcome to Vital Quo. On this channel, we take complicated medical information and break it down into something clear and useful, so you can actually apply it to protect your health and the health of people you love. If that's valuable to you, go ahead and subscribe, because we release new videos like this every week. One more thing before we start: this video is for educational purposes. It's not a substitute for professional medical advice. If you or someone near you is experiencing any of these symptoms right now, don't wait until the end of this video, call emergency services immediately. With that said, let's get into it. Before we go through the warning signs, it helps to understand what a stroke actually is, because that understanding is what makes these signs make sense. A stroke happens when blood flow to part of your brain is interrupted. This can happen in 2 main ways. The first, and most common, is called an ischemic stroke, which accounts for around 87% of all strokes. This occurs when a blood clot blocks a blood vessel supplying blood to the brain. The second type is a hemorrhagic stroke, which happens when a blood vessel in the brain actually ruptures and bleeds into surrounding tissue. In both cases, the result is the same at a basic level: brain cells in the affected area stop receiving oxygen and nutrients. And brain cells are incredibly sensitive to this kind of deprivation. Within minutes, they begin to die. This is why medical professionals often say time is brain. For every minute a stroke goes untreated, the average patient loses about 1.9 million neurons. This is also why the warning signs matter so much. Many strokes don't come out of nowhere. They're often preceded by a related but temporary event called a transient ischemic attack, or TIA, sometimes referred to as a mini-stroke. A TIA happens when blood flow to the brain is blocked briefly, often for just a few minutes, and then resolves on its own. The symptoms can look identical to a full stroke, but they go away, sometimes within minutes, sometimes within a couple of hours. Here's the critical part: research shows that roughly 1 in 3 people who experience a TIA will go on to have a full stroke, and a significant percentage of those strokes happen within 48 hours of the TIA. This is why understanding these signs, even when they seem to resolve on their own, is so important. Your body isn't randomly malfunctioning. It's giving you a preview of what could happen if the underlying blockage isn't addressed. With that foundation, let's go through the 9 signs. The first sign is a sudden, severe headache unlike any other. Doctors often describe this as a thunderclap headache, the headache that comes on suddenly and intensely, often described by patients as the worst headache of their life. This is particularly associated with hemorrhagic stroke, where a blood vessel in the brain has either weakened significantly or has begun to leak. What makes this different from a normal headache or migraine is the suddenness and intensity. A typical tension headache builds gradually. A thunderclap headache hits its peak intensity within seconds to a couple of minutes. Patients often describe it as feeling like being struck in the head, or like something inside their skull has suddenly given way. If this headache is accompanied by any other symptom on this list, vision changes, weakness, confusion, it should be treated as a medical emergency immediately. Even on its own, a sudden and severe headache that is unlike anything you've experienced before warrants urgent medical attention, because it can indicate bleeding in the brain that requires immediate intervention. The second sign is sudden numbness or weakness, especially on one side of the body. This is one of the most classic and well-recognized signs of stroke, and for good reason. It's one of the most common early indicators. It typically affects the face, arm, or leg, and the defining characteristic is that it usually occurs on just one side of the body. Here's what's happening internally: each side of your brain controls the opposite side of your body. So if a blood clot or bleed is affecting the left side of the brain, symptoms will typically show up on the right side of the body, and vice versa. This is why you might notice your right arm suddenly feels heavy or numb, while your left arm feels completely normal. This weakness or numbness can range from subtle, a slight tingling or a feeling that your arm just doesn't feel quite right, to severe, where the limb becomes difficult or impossible to move. A simple test doctors use is asking someone to raise both arms above their head. If one arm drifts downward or can't be raised at all, this is a significant warning sign. Facial involvement is particularly telling. You might notice one side of the face appears to droop, or that a smile looks uneven, with one corner of the mouth not lifting properly. Family members or co-workers often notice this before the person experiencing it does, which is why awareness of these signs matters not just for yourself, but for the people around you. The third sign is sudden confusion or trouble understanding. This sign is often the most likely to be dismissed or misattributed to something else, like fatigue, stress, or even normal aging in older adults. But sudden confusion, meaning it comes on abruptly rather than gradually over weeks or months, can indicate that a stroke is affecting the areas of the brain responsible for processing information and language comprehension. This might look like someone suddenly struggling to follow a conversation they were engaged in moments earlier, seeming disoriented about where they are or what time it is, or having difficulty understanding simple instructions. It's different from general forgetfulness because of how suddenly it appears and how out of character it seems for that person. Family members often describe this as the person just not seeming like themselves, a vague but important observation. If someone who was coherent and engaged suddenly becomes confused, disoriented, or unable to follow simple conversation within a short window of time, this needs immediate medical evaluation. The fourth sign is sudden trouble speaking or slurred speech. This is medically referred to as dysarthria when it involves slurred or slow speech, or aphasia when it involves difficulty finding words or forming coherent sentences. Both can be signs that a stroke is affecting the language centers of the brain, which for most people are located in the left hemisphere. You might notice someone's speech suddenly sounds slurred, as if they've been drinking, even though they haven't. Or they might struggle to get words out, pausing frequently, substituting the wrong words, or speaking in a way that doesn't quite make sense, even though they seem to understand what they want to say. A simple test used by emergency responders is asking the person to repeat a simple sentence, such as "the sky is blue." If their speech is slurred, garbled, or they are unable to repeat the sentence correctly, this is a significant warning sign that requires immediate attention. It's worth noting that this symptom can be particularly frightening for the person experiencing it, because they may be fully aware of what they want to say but physically unable to produce the correct words. This disconnect between intention and ability is a hallmark of stroke-related speech difficulty. The fifth sign is sudden vision problems in one or both eyes. Vision changes related to stroke can take several forms. You might experience sudden blurred vision, double vision, or a partial or complete loss of vision in one eye. Some people describe it as a curtain or shadow suddenly descending over part of their visual field. This happens because the areas of the brain responsible for processing visual information can be affected by reduced blood flow, or because the blood vessels supplying the eye itself are compromised. A specific and important variant of this is called amaurosis fugax, which is a temporary loss of vision in one eye, often described as a graying out or blackout that typically lasts only a few minutes before vision returns to normal. While this temporary vision loss can be alarming, the fact that it resolves doesn't mean it should be ignored. In fact, amaurosis fugax is often considered a strong indicator of an impending stroke, because it frequently results from a small clot or piece of plaque temporarily blocking blood flow to the retina, the same mechanism that can cause a full stroke if a larger vessel becomes blocked. The sixth sign is sudden dizziness, loss of balance, or coordination. This sign is particularly tricky because dizziness has so many possible causes. Inner ear issues, dehydration, low blood sugar, and simple lightheadedness are all far more common than stroke. This is part of why stroke-related dizziness is so often misdiagnosed or dismissed, which we'll talk more about in the next sign. Stroke-related dizziness tends to be different from typical lightheadedness in a few key ways. It often comes on suddenly rather than gradually. It's frequently accompanied by other symptoms, difficulty walking, a feeling that the room is spinning combined with weakness on one side, or trouble coordinating movements that were previously automatic, like reaching for an object or walking in a straight line. This type of dizziness and coordination loss is often related to a stroke affecting the cerebellum, the part of the brain responsible for balance and coordinated movement, or the brainstem, which connects the brain to the spinal cord and controls many automatic functions. If dizziness comes on suddenly and is accompanied by any difficulty walking, sudden clumsiness, or a loss of coordination that seems out of proportion to typical dizzy spells, this combination should be taken seriously rather than assumed to be something minor. The seventh sign is sudden, severe vertigo that's often misdiagnosed as an inner ear problem, and this one deserves extra attention, because it's specifically the sign doctors identify as most commonly misdiagnosed. Strokes affecting the back of the brain, specifically the brainstem or cerebellum, sometimes called posterior circulation strokes, can present almost identically to a common and far less dangerous condition called vestibular neuritis, or inner ear inflammation. Both conditions can cause sudden, severe vertigo, an intense spinning sensation, along with nausea and vomiting. Because inner ear problems are so much more common than posterior circulation strokes, and because the symptoms can look nearly identical in the early stages, this type of stroke is frequently misdiagnosed, particularly in emergency room settings where standard stroke assessments may not catch it. Here's what can help differentiate the two. Posterior circulation strokes are more likely to include additional symptoms beyond vertigo, things like double vision, difficulty swallowing, slurred speech, or numbness on one side of the face or body. Inner ear conditions, while intensely uncomfortable, typically don't come with these additional neurological symptoms. If you or someone you know experiences sudden, severe vertigo, especially if it's accompanied by any other symptom on this list, even a mild one, it's important to specifically mention the possibility of a stroke to medical providers, and to seek an evaluation that includes proper neurological assessment rather than assuming it's simply an inner ear issue. The eighth sign is sudden difficulty walking. This can present as a sudden staggering gait, a feeling that one leg isn't responding properly, or an overall loss of coordination that makes walking feel unfamiliar or unsafe. Like several of the signs we've covered, this often results from the brain's motor control centers or the cerebellum being affected by interrupted blood flow. This sign is sometimes described by patients as feeling like they're walking as if they're on a boat, or that one leg simply isn't cooperating the way it should. It may be accompanied by weakness in one leg specifically, or by the coordination and balance issues we discussed earlier. The key distinguishing factor here, again, is suddenness. Difficulty walking that develops gradually over weeks or months is far more likely to be related to something like arthritis, muscle weakness from disuse, or a chronic neurological condition. Difficulty walking that appears suddenly, within minutes to hours, combined with any other symptom on this list is a significant red flag. And the ninth and final sign is fatigue and unusual tiredness in the days leading up to a stroke. This is the one most people have experienced at some point and dismissed without a second thought, which is exactly why it's important to mention. Some research suggests that unusual, unexplained fatigue can precede a stroke by several days, particularly when it's a sudden shift from someone's normal energy levels rather than a gradual decline. This isn't the kind of tiredness that comes from a poor night's sleep or a demanding week. It's often described as a sudden, heavy exhaustion that doesn't match the person's recent activity level or sleep patterns. Some researchers believe this may be related to smaller, earlier disruptions in blood flow that don't produce obvious neurological symptoms but still affect overall brain function and energy regulation. On its own, unusual fatigue is a weak signal. It has so many possible explanations that it would be impractical to treat every tired day as a medical emergency. But when this kind of sudden, unexplained exhaustion occurs alongside any of the other 8 signs we've discussed, or in someone who has significant risk factors for stroke, it's worth paying closer attention to and discussing with a healthcare provider, rather than assuming it will simply pass with rest. Given how many of these signs can appear subtle or be confused with other conditions, medical professionals developed a simple method to help people recognize and respond to the most common and severe stroke symptoms quickly. It's called FAST. F stands for face drooping. Ask the person to smile. Does one side of the face droop or appear numb? Is the smile uneven? A stands for arm weakness. Ask the person to raise both arms. Does one arm drift downward or feel weak compared to the other? S stands for speech difficulty. Ask the person to repeat a simple phrase. Is their speech slurred, strange, or difficult to understand? Are they unable to repeat the sentence correctly? And T stands for time to call emergency services. If you observe any of these signs, even if they seem to resolve, call emergency services immediately and note the time when symptoms first appeared. This time is critical because certain stroke treatments, like clot-dissolving medication, are only effective within a specific window from symptom onset, often within 3 to 4.5 hours. This is worth repeating, even if symptoms go away on their own, this does not mean the danger has passed. As we discussed earlier with tears, resolved symptoms can still indicate a serious, ongoing risk of a full stroke in the near future. Never wait to see if symptoms return before seeking medical care. While stroke can happen to anyone, certain factors significantly increase risk, and understanding them can help you assess your own risk level or that of someone you care about. High blood pressure is the single most significant controllable risk factor for stroke. Consistently elevated blood pressure damages blood vessel walls over time, making them more susceptible to blockages and ruptures. This is why regular blood pressure monitoring, especially after age 50, is so important. Atrial fibrillation, an irregular heart rhythm, significantly increases stroke risk because it can cause blood to pool in the heart and form clots, which can then travel to the brain. If you've been diagnosed with atrial fibrillation, your risk of stroke is meaningfully elevated, and this should be actively managed with your doctor. Diabetes, high cholesterol, smoking, obesity, and a sedentary lifestyle all contribute to the buildup of plaque in blood vessels, a process called atherosclerosis, which narrows arteries and increases the likelihood of a blockage. Age is also a significant factor. The risk of stroke roughly doubles for each decade after age 55. Family history matters too. Having a close relative who has had a stroke increases your own risk. It's worth noting that while these risk factors increase the likelihood of stroke, they don't guarantee it, and their absence doesn't guarantee immunity. This is exactly why knowing the warning signs matters for everyone, regardless of how many risk factors apply to you personally. The encouraging news is that up to 80% of strokes are considered preventable through lifestyle and medical management. Blood pressure management is the single most impactful step most people can take. This means regular monitoring, taking prescribed medications consistently if you have hypertension, reducing sodium intake, and maintaining a healthy weight. Regular physical activity, even moderate amounts like the daily walking we discussed in a previous video, helps maintain healthy blood vessels, supports healthy blood pressure, and improves overall cardiovascular function. Managing diabetes and cholesterol through diet, medication when necessary, and regular checkups helps prevent the arterial damage that contributes to stroke risk over time. Avoiding smoking is critical, as smoking significantly damages blood vessels and increases clotting risk. If you currently smoke, reducing or quitting is one of the most impactful changes you can make for stroke prevention specifically. And finally, regular checkups that include blood pressure screening, and for those with risk factors, heart rhythm monitoring, allow potential issues to be caught and managed before they escalate into a stroke. If you take one thing away from this video, let it be this: strokes rarely happen without any warning at all. The body often gives signals, sometimes subtle, sometimes more obvious, in the hours or days before a major event. Recognizing these signs, in yourself or in someone you care about, and acting immediately rather than waiting to see if things improve, can be the difference between a full recovery and permanent disability, or worse. If this video helped you understand these warning signs more clearly, please share it with someone in your life, a parent,